But we also have an opportunity here to, given that many countries are trying out different policies, and of course in Indonesia we've seen new policies being implemented, the graphic warning labels that were introduced last year. So we can be collecting data all that time to try and find out what is the impact of those policies. What kind of impact are they having? And we can draw comparisons between countries to see what works and what doesn't. So also, when we're thinking about doing research in this area, I think it's helpful to think about this. So in epidemiology, we talk about the epidemiologic model. I don't know if any of you have been introduced to this in other classes, but we talk about in infectious disease epidemiology the agent, host, vector, and environment. So the agent is the disease organism. The vector is, however that organism is transmitted. The host is the person who gets sick. And the environment is all the other factors that influence disease risk. So we can say the same thing in tobacco, where we have the agent is the cigarette, the host is the person who, the smoker, the vector in this case is the tobacco industry. So the tobacco industry is kind of like the mosquito that spreads malaria. And then there's the environment, which is all the other policies and cultural and economic factors that influence tobacco use. So when we're thinking about research on tobacco control, we're thinking about not just studying the smoker and the health impact, but also studying the cigarette itself, the tobacco industry, how they market their product, and also the surrounding environment and how that influences tobacco use behavior. So I think there are some particular challenges in addressing tobacco control in low and middle income countries, including often lack of resources, high tobacco use prevalence among health professionals, and then also sometimes resistance to tobacco control. So these are some of the challenges we have to deal with in many countries. So I just want to highlight a couple of additional challenges here. So one challenge is we're starting to see a lot of new tobacco products come out, and being widely used. So one example is the shisha or water pipe. We're seeing becoming increasingly popular among young people, especially in many countries around the world, not just in countries where it's traditionally used. The e-cigarette is another example, electronic cigarette, where I know it's appeared here in Indonesia, maybe not widely used yet, but it's increased very quickly in many other countries. We don't know a lot about what the effects of that are. And we're also seeing new packaging designs, new product designs, new marketing to appeal to a different category of users. So, and I put up an example of some cigarette products marketed especially to young women, which is a new trend we're seeing, and I think particularly in countries where tobacco use has traditionally been low among women, like in Indonesia. That's starting to change now, and we're seeing cigarette packages that look like a lipstick container or use bright colors and are meant clearly to appeal to women. So going forward, I think there are still a lot of unanswered research questions, a lot of great opportunities for doing research around tobacco control. We know a lot about what works, what's effective, but there are also some critical research questions that still need to be addressed. And so I just highlighted 4 up here just to for you to think about. One is we need to understand the product itself better, different types of products, different patterns of use. So like I mentioned, the electronic cigarette, as new products like this come out, we want to understand who's using them, what are their effects. We want to understand how socioeconomic transitions impact tobacco use. So as people, as their incomes increase, they have more money to spend on cigarettes. How does that change smoking behavior? what types of interventions can we do in an environment where we have limited resources. So in Indonesia, we have many islands that are very isolated. They may not have ready access to a healthcare center. They have limited resources. What can we do to help people who want to quit smoking there? And then finally, to think about what kind of data is it that will really make a difference for decision makers. So when we're promoting a tobacco control policy, often we need to persuade not just the Minister of Health, but also the Minister of Finance and other decision makers. So we need to figure out what kind of evidence do we need to address the concerns of each of those constituents. I think we need to think about public health research more broadly than just the disease itself, but to think about all these other factors that influence behavior and influence how public health interventions are implemented and whether they're successful or not. So anyway, I'll just leave you with those questions, but I'm happy to answer any questions or discuss a little further.
I'm majoring in health promotion program. I have a question to you, Mr. Mark. I have read a research statement from the tobacco industry that advertisement have big impact to customer perception. Mr. Mark, what's your opinion about tobacco product perception and customer response according to related with the tobacco product that you explained before, and how to reduce impact of the tobacco product perception to public or community as a target in developing countries. So I focus at the advertisement in tobacco product. Maybe you can explain more about that. Thank you.
I would like to address questions for you related to the early initiations of school health programs regarding to the tobacco control and also the smoking. I think it is very helpful for us and very interesting if you want to share what is policy regarding to the school curriculum that implement the smoking or tobacco control. I think that's one. Thank you.
In fact, we have NCI, we put out another report recently on the media and advertising and tobacco use. And one of the conclusions of that report is that tobacco advertising is a substantial factor in increasing youth smoking. So in terms of what we can do, certainly to limit advertising of tobacco products is something that's been done in many countries. So to prohibit certain types of advertisements, many countries now have banned tobacco advertising on broadcast media, on TV, and thinking that, well, these are venues that are going to be seen by kids. Also to ban billboards and other kinds of advertising that are seen openly. But we've often seen that when we implement a policy like that, the tobacco industry is very effective at finding other ways to get their message out. So we can ban billboards and ban TV advertising, but then they focus more on advertising at the in kiosks on the street at the point of where cigarettes are sold. You see banners, and I see that here. In Jogja, all over banners around the stalls advertising cigarettes. They find ways to sponsor. We just had lunch at a restaurant that had a tobacco tobacco company sponsor with kind of branding all around the restaurant. So it is a challenge, but I think we can't necessarily eliminate all of those influences, but we can find ways to reduce their impact, and particularly reduce their ability to reach kids and young people. So the other question in terms of about schools. So we've actually had mixed success with school education programs, and I think it's important to educate kids about the health risks of smoking, but I think we have to understand that that by itself too is not enough. And we've found that even where there have been sort of very in-depth educational programs introduced in schools, they don't have the impact that we might expect. And I think part of that is just that kids get influences from many places and not just from school. They get influences from their peers outside the school. They get influences from television and media. They get influences from their parents. And so we have to address some of those other factors as well. So I think the education programs are important, but we need to also consider these other factors in the environment.
My name is Kuliah from majoring health promotion. Thank you, Mr. Mark. Your presentation is really help us to understand about our odds and our challenge to do tobacco control. I want to ask about the advertising tobacco, same like Mr. Cahaya said. Can you give me some example in US, maybe any approach to stop or even reduce tobacco ads in US? Can you give me some example like that? Thank you.
And I would like to ask you, in US, I don't know much about US, but I think it's a country that didn't depend on tobacco produce. But in Indonesia here, almost there's a place who live from tobacco use. So I think it's written on one of your slides that it's become a problem. So in your opinion, as epidemiologist and as an expert who already see the examples in the older world, what should we do as a future decision makers to so we didn't kill the money, the industry, but also we cut the half the health effect of tobacco. Okay, thank you.
Yeah, so those are both great questions. So, in terms of an example of so first of all, the U.S. does not have a comprehensive ban on all tobacco advertising. So I actually wouldn't necessarily. That's one of the areas where the U.S. is probably weaker. So I would not necessarily hold the U.S. up as an example. I think there are other countries that have actually taken even more advanced steps to control tobacco marketing. But we did ban tobacco advertising on television and radio back in 1970, which I think was an important step. Most recently, the U.S. Food and Drug Administration was given authority to regulate tobacco advertising. So they have actually now just, this is relatively new, started to put into place policies to so now they have prohibited sponsorship of sporting and entertainment events by tobacco brands, tobacco companies. That's certainly been, I think, very important. And they've also prohibited, certain kinds of advertising near schools and that sort of thing. But as I mentioned, the tobacco industry is very effective at trying to find other ways to get their message out. And so what's happening now is a number of states are trying to implement their own more restrictive advertising controls, particularly control advertising like at the point of sale, because when kids go into a convenience store, they're often confronted with all these cigarettes and the advertising. So how do you get rid of that? So those are some of the things that we've been trying to do. So in terms of the tobacco growers and the tobacco industry, I think that's an important question. And we, in the U.S. also, we have a tobacco growing industry, just like in Indonesia. And I think there was a lot of concern about what the impact of tobacco control would be on that. In general, we found that There are other countries also that have a high dependence on tobacco farming, or at least certain segments of the country do. And implementing tobacco control laws does not necessarily directly affect those farmers, however, because many of them are producing tobacco not just for the local market, but also to sell elsewhere. So I think that's one thing to keep in mind. The other is there is research going on now to help tobacco farmers find ways to convert to other crops. So many tobacco farmers are actually not getting such a great deal now from the tobacco industry. The tobacco industry is now a large transnational industry. They have been driving down the price of raw tobacco. So tobacco farmers are actually finding it harder and harder to make a living. And I think that's true in Indonesia as in many other countries. So it's really, in the future, is not a sustainable model for the indefinite future. So I think the best way to help the farmers is really to help them to find a more sustainable way to make a living, which probably means transitioning off of tobacco to other crops. But I think you make a good point that we need to have research to help support that and to explain to policymakers, well, what's the plan for tobacco farmers and how can we help them while at the same time, reducing tobacco use.
My name is Muhammad Aswallah. I'm the graduate student's health and nutrition majoring. I'd like to take a case in Indonesia. Is a case in Indonesia, especially about if you talk about the law about the tobacco control. Indonesia, the first step that Indonesia produced the law is about smoke-free area. Smoke-free area, and then maybe the cigarette company and or the smoker organizations try to discuss about the law, and then the second policy is about the public place have to make a special room for smoker. If we talk about it, it's like give the chance for the smokers to still smoke in public area. I think and maybe the cigarette company or the smokers organization or something like that has the reason about the human right. What the best answer to give to the public or the decision maker if we talk about the human right? The first question. The second question is about if policy about the smoke-free area produced in especially Indonesia, and then maybe the smoker will prefer to smoke in home. I mean, how to prevent the vape for the family members, especially for mother, for child, or etc. Because if we talk about the metabolism or something like that, if the father smoke in home, maybe we'll produce the result is child maybe stunting or something like that. Thank you very much.
If you provide a smoking room inside a building, people are still going to be exposed because the evidence suggests that the smoke is not, it's impossible to entirely separate the smoke from the rest of the building. So even people who are not in the smoking room, the smoke is still going to circulate through the ventilation system and that. So that's why generally the gold standard is not to have smoking rooms inside, but just to prohibit smoking in the building entirely and expect people to go outside to smoke. Especially in a country like Indonesia with a temperate climate, people can always go outside to smoke. So I think so hopefully that the characteristics of that law may change in the future. I know some countries, for example, in Spain, they put in place a smoke-free law first that allowed for smoking sections in restaurants, and then eventually they later revised the law and prohibited smoking in all restaurants. So that way, that's really the only way to ensure that other customers, the employees in the restaurant are not going to get exposed. So in terms of smoking in the home, I think that's a great point, and we need to, there is actually evidence that a non-smoker who lives with a smoker has a higher risk of lung cancer and other tobacco-related diseases. We also know that secondhand smoke exposure does have an impact on the healthy pregnancy and on the child. Being in a, exposure to secondhand smoke during pregnancy is associated with having a low birth weight baby, which obviously has many other adverse effects. So that is a big concern. I think that's something that maybe should get more attention, here in Indonesia, given that smoking prevalence is so high among men, but it's also affecting not only the men who are smoking, but also their family. And maybe if we made an effort to communicate that more, that might be a helpful message to reduce smoking. Good point. I think the tobacco industry sometimes uses this idea of smokers' right to smoke. But I guess I would say, first of all, I don't think you have, when your smoking is also harming other people, you don't have a right to do something that is going to harm other people, the same as you don't have a right to hit someone or to harm them in some other way. I think the fact that smokers, their smoking is affecting not only themselves but the other people around them, that's, they don't have a right to impose that harm on other people. So I think that's an important message to get across. There is actually some effort now to use some of the international models, international thinking around human rights and international legal mechanisms around human rights to see if we can use that to also support tobacco control efforts. I think that's an area that still needs to be explored, but it would be interesting. Yeah.
My lecture says that nowadays in Indonesia, the smokers not just men, but the women also the amount of the smokers from women also increased, and it because of there is a statement in Indonesia said that woman emancipation. It means that women equal with men. What do you think about that? What is your opinion? And what do you think about how to overcome the statement so the amount of the smoker from women can be reduced? Thank you.
It's kind of a symbol of being a modern woman, being, having freedom, independence. And it's very challenging to counteract that. Obviously, we want to support, be supportive of that increased status that women have, but without having the smoking go along with it. There was a paper that came out recently, looking across many countries where we'd seen an increase in smoking among women, and the conclusion was, and I thought they put this in a kind of attention-getting way, was that they said we've seen across many countries where women smoke like men, they die like men, and so I think it's important to get the message across that women who smoke are going to be subject to all the same health effects that we've seen in men. And on top of that, maybe we can also focus on the impact of smoking on the family, and that for the smoker, it's affecting not only themselves as an individual, but their family members around them. I don't know if that would be an effective message as well, but. I think I don't have all the answers here because I'm not an expert on the local culture, but I think that's the research we need to do, is to find out, well, what kinds of messages can we use to prevent an increase in smoking behavior among women.
I have one question related to the tobacco control. I'm focusing on persons with disabilities as a vulnerable community. And is there any guideline about tobacco control to specific populations? In this case, I want to ask about the people with disability, because we know that the smoking is really harmful for them. They can be a second-hand smoker, and also they can be the first-hand smoker. So what do you think about it? Is it any guideline? And so, thank you.
And is there any particular group that you have in mind, or just people with any kind of disabilities?
Maybe all, because we know that for persons with blindness, some of them may be literate with Braille, and we have to translate it into Braille, and maybe some of them, maybe for deaf, they need to be translated into the sign language. Yes, yeah. And Indonesian sign language, not American sign language.
Definitely a need to have interventions that are targeted to specific groups. I think, we've been effective maybe in certain cases in dealing with that, addressing, there are cessation programs targeted at, certain racial ethnic groups or certain cultural groups. But actually, I think that's an area that really has not gotten enough research, is how do you ensure that, the interventions we're doing are also going to reach, people who are, have a handicap of some kind. How do we ensure that the non-smoking messages are accessible to them? And so, I mean, again, I guess I would say I don't have all the answers, but I think that would be a great area for research, too. I would, though, just mention one area where, there has been a lot of attention, and that is tobacco use among people with, a mental health condition. So we know that people who with schizophrenia or other mental health conditions have a dramatically higher prevalence of smoking. And the thinking is that they tend to use smoking as a kind of way of self-medicating. I think that group in particular needs a particular kind of intervention, that will, be able to address their smoking behavior, but also at the same time address the other, issues that they may have. Yeah, so I think there are, there are guidelines, I think, for cessation among mental health patients. I'm not sure if there are guidelines specifically for, say people who have other disabilities who are either blind or deaf. But certainly there is a need for tools that can help us get messages across to those people. So in the U.S. we have a set of cessation guidelines. A number of other countries have this, and that includes specific recommendations for certain subgroups. So I think one thing to think about for Indonesia is, as far as I know, there isn't any kind of cessation guideline for the country in general, with some culturally tailored, intervention strategies. So I think that would be a first step, to have that guideline, and then that could include also some specific recommendations for, specific groups as well. Yeah.
Okay, yeah, we are having very fruitful discussion today, but we are really sorry that time is really up. We have stretched like 20 minutes, the courtesy of Bu Supri. Thank you so much for willing to share his lecture time with us. So students, I think the time is up. Can we give a very good applause for Dr. Mark? And Pak Mark, thank you so much for sharing your expertise with our public health graduate students, and we're hoping anytime you visit Indonesia, then you can give another lectures for us. Oke, terima kasih banyak Bapak dan Ibu, selamat melanjutkan kuliah kembali siang hari ini. Selamat siang.